All right. Welcome to blackdoctor.org, where wellness and culture connect. I am Dr. Cordai Decoto, board certified podiatrist, fellow of the Academy of Foot and Ankle Surgery, podiatrist for Neighborhood Health, which is a qualified health center in New Jersey, providing care for all, regardless of insurance and immigration status. I now am back in Essex County, guys, for those asking, with the Foot and Ankle Centers of New York and New Jersey, and I will be practicing part-time in Belleville, which I'm excited about. I am also the co-founder of Sisters in Podiatry, which is a Facebook group for Black women in podiatry within the United States and the Caribbean. And of course, your hostess with the mostest for Stepping Forward with Dr. D, your gateway to all things of the lower extremity. So grab your favorite beverage. I have my cute podiatry cup and my tea, and let's get ready to rumble. This is West Coast versus East Coast. And I'm absolutely so happy to invite these two fabulous podiatrists that I call friends. They were colleagues. We went to school together. So we will start with Dr. Nazila Eshraghi. And I think she's coming on.
Hello.
Hey. So Dr. Nazila Eshraghi is been a podiatrist for over 20 years. That just sounds crazy. 20 years of experience, and is a second generation doctor from a pediatrician and a nurse who offers personalized care at her practice, Complete Feet Care in Lake Wylie, South Kakalaki, Carolina, across the River Hills main entrance. And she is a fabulous doctor, and I'll tell you more about her. She is compassionate. She is a graduate from my school as well, the New York College of Podiatric Medicine, and honed her skills in foot and ankle surgery at Weill Cornell affiliated hospitals. She treats everything from ingrown toenails to diabetic foot, bunions, tailored solutions to your foot, because everybody's different. She does custom orthotics, advanced treatments for nail fungus. You know, summer's coming, guys. And just empowers people to live an active, pain-free life. So with no further ado, I welcome my friend, Nazila Eshraghi. Welcome, East Coast.
Thank you.
Thank you for coming. Our next guest, you know, is Dr. Andrew Langrudi.
Hi there.
Hey, Andrew.
How are you?
I'm fine. So Dr. Langrudi practices in the Oxnard area in where? Cali, for all our West Coast folks. He is compassionate and provides individualized care for his patients. He has his training from the University of California. We'll forgive him, though, all the East Coast folks. And he also went to the New York College of Podiatric Medicine, at which we love because we all went there, and did his residency program at the Department of Veteran Affairs, Los Angeles, and Olive View, UCLA Medical Center. Now, Dr. Langrudi's high tech. He practices now in a fabulous group practice, and he's board certified, like myself, the American Board of Foot and Ankle Surgery, as well as the American Podiatric Medical Association and the American Board of Sports Medicine, and former attending podiatric surgeon for Sherman Oaks Hospital Podiatric Medicine and Surgery Residency Program. It is my pleasure to bring them both. I call them the Persian persuasion. That's my joke. And I'm just so happy to have you guys here. Welcome. What we always do, we tell everybody, is they log in, let us know where you're from. We love it. Log in, log on. Welcome, welcome, welcome. We want to shout you out. So log on because we're excited to have you here. So let's ladies first. So Dr. Eshraghi, we went to school together. I don't know what that's 20 business. Let everybody mind your business. But anyways, we went to school together.
3 years ago.
I remember you moved.
3 years ago.
That's right.
No. That means I have to go. How many more years practicing now?
So I remember that you moved to the West Coast. You went back. That was home for you. Tell us what the experience was like practicing in the West Coast, and then tell us how you came to the East Coast. I think everybody's kind of like, Cali, South Carolina, what?
Actually, home was Washington State for me, Northwest. And then I moved to West Coast to Southern California,
Where it doesn't rain.
Practicing there is very different than South Carolina. It was I grew up in Washington State and lived in New York and moved to California, and these were the states that I had lived in. So moving to South Carolina was a little bit shocking because I had to come across a lot of obstacles and rules and regulations that are so different from West Coast, Northwest, and East Coast, like New York. They're all very similar rules and regulations, but South Carolina is a beast of its own.
Mhm.
So, but
Imagine.
having said that, there is a lot of advantages working in South Carolina. There is a lack of doctors. I am number 706
When you said
licensed.
that number, so for those people who are like, what's she talking about? 70, so we know we usually have you have a medical number. I can't tell you what mine is, but to know that you're 706 shows you the scarcity of podiatrists in that area. Because I'm sure Andrew doesn't know. Andrew, you don't know that number. So that just is a statement in and of itself. But continue.
I moved here during the pandemic, so there was a lot of things happening in the medical field here in South Carolina. And it was during the time that there was a lot of marketplace insurance at the beginning. It was at the beginning of marketplace insurance and everything. Blue Cross Blue Shield has about 80 to 90% of the marketplace insurance. And holy smokes, dealing with them. Now, I'm not a group practice. I am a solo practice. I prefer it like that. And it took him 3 years to get the paperwork correct. And to this day, I still have issues with them. And then they just opened up a huge clinic next down the street from me, and I just saw the doctor there, and she told me, and that's a huge like group practice that is associated with a hospital and everything. It took them 5 years to get on Blue Cross Blue Shield.
Wow.
That's insanity.
And I am the only podiatrist in town, and right across the bridge, so I have all the little cities on the other side of the lake that is in North Carolina that I tap into that pool, and I have all the little towns on this side of the lake, which is South Carolina. And I've been getting anywhere from 7 to 10 new patients a day. I just added another day to my office, so I'm working 4 days a week. I see patients anywhere from 10 to 15 patients a day.
Good
Mostly ends up being cash patients, and my patient demographic is very different than the patient demographic that I practiced in. Where I used to practice was in Thousand Oaks, and it was how can I say this? Okay, so it's like being a dentist in California and then going to London and being a dentist.
Big change.
Do you understand what I'm saying? People, I have to teach my patients on how to just basic care of their feet. So, because everybody's on their feet all the time, and then I have a huge retirement community, and they're all super wealthy, generational wealth, and they are on their feet all day long playing pickleball, golf, tennis, and very active. And then on the other extreme, I have a population that is on their feet and is mostly construction work.
Working class.
Yeah, working class. People that they really need someone to take care of their feet for them, but they're too embarrassed to go get a pedicure. And most of them, their nails are like, when we talk about ram's horn,
We'll
that's
get into
what
that later.
yes, that's what I deal with. So it's basically, I'm offering medical pedicures, which they come and they pay cash, $200. And at that point, I evaluate their feet. I tell them, if they have calluses, everything. I tell them they need orthotics. I have a store down the street from me. It's called Fleet Feet, which
We have it too in Montclair.
They sell
New Jersey.
orthotics for $1,500 for these stupid 3D print orthotics. Yeah. So
hold on, I'm going to stop you because you're getting into more of the stuff that I want to talk about. So I'm going to stop you for a second. Andrew, so it's been so long. I haven't seen Andrew I haven't seen either one of them since graduation, but because we're technologically savvy, it's very fun to be on here. So you are West Coast.
Yes,
Cali.
I am.
And I've messed you up completely because it's 4:00.
I know. I was.
We were supposed to have Dr. Naseem Kalhor on. In case you guys are like, where is she? That's his wife. And actually, she's in the operating room. So the time has screwed them up a little bit. And we apologize to all our Cali folks who are probably giving us a side eye. This show is recorded where you can find on my YouTube channel, my Facebook. I'm everything at Talks with Dr. D, and Black.org also hosts this. So Andrew, I'm East Coast all day. Okay.
I know.
So,
yes.
I grew up in, Canadian born, lived in Miami, and, went to school with you guys in New York, stayed in New York for years, and now I'm in Jersey. So tell me, what is practice like on the West Coast? Particularly you're in a group practice with multiple locations. Explain to us what's that like on the West Coast and what's so special, the je ne sais quoi of the West Coast.
Thanks for having us on.
Absolutely.
Great seeing you guys. Group practice is great because it gives you more flexibility. If somebody's sick, one of the doctors, or they want to go somewhere, you're able to cover that person, and it gives us more options. The patients have more options because if somebody's out, they can go ahead and see somebody else right away, so they don't have to wait a few days or a week or things like that. So we get the patients in quickly, very quick actually. Nobody really has to wait that long. We are a very busy office. We have 7 podiatry locations throughout Southern California, starting from Santa Barbara, coming down to LA County and Ventura County. And 7 doctors as well. So it does help quite a bit.
Sounds amazing. So I'm going to say now, Nazila, you have Dr. Shragi, you have you can talk in so many different levels because you lived and practiced on the West Coast, and now you're in a whole different, what you're telling me, it's a whole different world from what Dr. Languti is telling me. I'm like, and I'm in the middle, I think, somewhere. So the questions I'm going to ask you guys, because I'm going to go through questions and different things. The first question, I'll throw it back to Dr. Languti. If I'm in the West Coast and you've been on the East Coast because of school, what do you think? What is your practice? First, tell us the name of your practice and what special things do you offer? Because LA is, a city where, granted, people drive, but people are walking. I see them in their Manolos and their Jimmy Choos and anything to their Birkenstocks. So what do you think that you bring in terms of great foot care from your practice?
Yeah,
and then I'll ask you one question, Dr.
Sure. My group practice is called Foot and Ankle Concepts. Basically, everybody thinks that everybody drives so much in LA. It is true, but obviously people also exercise a lot more, I think, in the West Coast compared to the East Coast. I think more people are into going out, running, and things like that when you compare it to the West Coast.
You think it's because of temperature? It doesn't rain in Southern California.
Exactly. Yeah, absolutely. I think it does. One of the reasons is that, and they like to take care of their feet. So we do see quite a bit of patients with foot problems, even that so many people are still driving. And our office, pretty much, we offer everything. We have everything in the office, A to
Like
Z.
what?
Starting with obviously X-rays, ultrasound, shockwave therapy, laser therapy. We got laser for the fungus. Anything as far as podiatry is concerned, we do offer it to patients. Only thing that we send people out is basically for MRIs and CT scans, which we don't have. So it's kind of a one-stop shop. When they come in, we can do everything for them.
So you, again, I'm going to make, because remember, we're talking to the public. So you said some big words. You said shockwave. Somebody's shocking me with something. What is he?
Yeah.
What does that
basically
mean?
therapeutic
What does shockwave
devices.
do?
Yeah, the therapeutic device that can reduce pain in the foot. It helps with plantar fascia, heel pain. People who have that, this helps quite a bit. And we do a lot of also PRP injections, stem cell injections in the
And
office
what's that?
as well. Yes, PRP is basically when we take the blood from the patient and spit it down, and we take the good cells from that and inject it to the area that the patients are having pain.
Fantastic. You see, I'm purposely doing it because, again,
yes, of course,
you know,
that's
we're
good.
chatting and we're like, yeah, PRP. Meanwhile, the person is like, who? And one of the things I wanted to do is give a shout out. Thanks, Rob DeLeo from Riverdale. That's my old stomping grounds. I lived in Riverdale for years. Love it. Thank you so much for supporting. Mitch Harris, thank you for supporting. Gilda Matt Benton, thank you for supporting. Fantastic. So I'm going to throw it to you, Dr. Shragi. So he named all these fabulous techniques because he is West Coast. What are you offering that, and would you say that I'm thinking from what you've said that your practice seems like more of the neighborhood podiatrist where you come in and this is happening?
Yes.
Is that what the vibe I'm getting? What do you offer?
Very, okay. So most of there is hardly any private practices around here. Mm-hmm. So I have brought a completely foreign concept to this area, which I am getting a lot of reception, and patients are loving it, and I am getting a lot of raves. They come in and they get a full 30 minutes from kind of from lower back to the feet evaluation, and it's more of a holistic approach. And they all want to get back on their feet stat, which we know is impossible. Lower extremity injuries, it takes a long time for them to go away, but majority of them don't have the luxury to not be able to go to work, and some of them they don't have the luxury, or they don't want to have the luxury by going on cruises, trips, their sports and other activities. So I offer them things that they come in, and when I explain things to the detail, I listen to the patient's history. Is a very important part of my practice. Listening to the patient, getting to the bottom of the thing, and not just fixing the problem in the foot, but educating the patient so the problem doesn't come back. And then I offer medical pedicure when they come in.
What is a medical pedicure?
Pedicure, the way I offer it is they get a complete evaluation of the skin on their feet. If they have calluses, I talk to them about their gait, their stance, and what they can do to prevent their calluses. Meanwhile, they get a complete like a deep cleaning of your teeth, would you say? Mm-hmm. So
this is not something that if I went to my local nail salon I could get, right?
No.
What's the difference?
It has, like, I use scalpels, I use different drill bit heads. It's like a deep cleaning.
But all those words are big words. I don't know what any of that means. So if I was talking to my friends, because I have friends watching this,
so let's say,
why come to you?
Yes, let's say, okay, in the community that I live, people love to go get gel polish on their toenails. Mm-hmm. This is becoming a very popular thing here, and I'm sure all over United States. Mm-hmm. They end up getting these toenails that I call them raisins on top of their toes. That that they constantly go paint and polish, and they think it's normal due to age, and they end up getting ingrown toenails, or they keep on going to they get pedicure once a month because they get ingrown toenails because they have forefoot pronation.
That's a big
And
word. I don't know what that means. My friend's looking at you like,
means that your toe is constantly rotating, where it puts pressure on the side of the toe and causing the change of the nail, where it becomes a chronic problem. So when you go to get a medical pedicure, your doctor evaluates your feet, gets you back to baseline. Like, I have a lot of patients that have deep fissures, cracks, bleeding cracks in their heels, calluses that are so painful from doing hard labor work. So those you can go to get a pedicure. So when they come to me, it gets them to baseline, and I educate them on what they need to do to make sure they can stay in baseline at least for the next 6 months or once a year, where they come back and see me.
so let me ask you a question. So Dr. Langrudi, so we're hearing that Dr. Eshraghi has a different way of practice. I like it. I call that the neighborhood podiatrist. You seem more West Coast, sitting on the side. And so tell me, besides, give me something that in your office that you think is amazing, that when a patient walks in, they're like, thank you. Since you said West Coast works, I think you're going to get beat up, but you said West Coast is more active than East Coast, simply because of weather. We'll give you that. I wouldn't say that. We're inside working out, okay? We're inside getting with the workouts. But what do patients are listening on the West Coast, what is sexy about your practice that you think that you offer to get your patients ambulatory?
We also in the West Coast listen to patients as well.
Oh, you do? I come from West Coast. I did that same thing in West Coast.
So I think, what I've done in the practice is that I have a, very high-end practice all over, different demographics, but they're all look the same. It's kind of like we make it all look, because it's a brand, and that's what we do. The difference is that we're giving that quality, but still with the family individual care. So, it's big corp. It's not big corp, really, it's small corp, but still, patients are still feeling that community feeling. So we do give that, because I'm distinguishing myself from the UCLA out here, from the, Cedars-Sinai type of, places that are just, a big hospital, and they have these clinics all over the place.
Oh my God,
Patients are
everywhere
not
is
getting the
becoming
care
like
they need.
that.
Yeah. So that's what I mean. The difference is that, we offer everything to the patient that, the patient needs, and let the patient choose also what they want. Whereas those type of facilities only talk about the things that they're allowed to use and give. And that's the difference. Like at Kaiser, they don't do certain things, so they never offer it. And then the patients come to us, they're like, oh, how come nobody told us? And then we're like, yeah, because they don't offer it, they don't talk about it. And that happens quite a bit. And that's what's important about our office that distinguishes us from everybody else in the area. For private practice in Southern California, we do have one of the biggest ones now, the amount of people that we see. So it's completely different than the other place. And most places, either it's the venture capital group that owns it, or it's part of a hospital group. But as far as individuals, we're like a big group in the area in Southern California.
The group that I'm coming out with, and you'll hear more about it because I have my monthly show, we're going to be the biggest group. And I'm excited about having a tailored practice to meet, as you said, individual needs. What may be for Miss Smith may not be for Mr. Blake, may not be for, what have you. And it can't just be a cookie cutter thing. And yes, insurance does dictate, unfortunately, at times what we can and cannot do. So once you're out of the model of private, if you're in private practice and you're offering, as Dr. Eshraghi was saying, cash-based things, it does give you a bit more flexibility. I want to give some shout outs because people are logging in. Thank you so much. Rebecca Johnson, thank you for watching. We appreciate it. One of my favorite patients, Michelle Reynolds West, thank you. She always supports. I appreciate you so much. Tracy Denise said, amen. Yes, sister. Amen. Thank you so much for supporting us. So let's turn a little bit because I like to talk surgeries because sometimes surgeries are necessary. So
Sure.
I'm going to throw it back at Dr. Eshraghi. So Dr. Eshraghi, I don't know. This is not a residency interview. A patient comes in, bunions, are big, and hammer toes. Those are pretty common for podiatrists. What do you offer your patients in terms of surgical treatment for those types of things?
I don't do surgery anymore.
What?
Yeah. I am taking myself completely out of the game of having to deal with insurance, hospitals, and all that. I am only doing cash, holistic medicine and getting because as we all know, foot surgery is very much like back surgery. There are times that it's necessary to do it, but majority of patients don't need surgery. So, and I like to treat a lot of my patients the non-surgical way and give them options, and when is the last option, ship them away.
So you do the referrals. So Dr. Langrudi, and I'm going to comment because I do surgery.
Yes.
So I'll throw that question at you. Bunions and hammer toes, podiatrists are known for a lot for that, and heel pain as well. What surgical techniques are you offering your patients, and what's your style?
Yeah, we do actually a lot of surgeries, but again, first
West Coast.
West Coast, yeah. But we do tell the patients, all the things that they need to do beforehand, conservative treatments, and then once they fail it, then they decide to do it, and then we go ahead and offer them the surgery because I think some people are just coming to look for surgery from the beginning, and those patients I always tell them, hey, you got to try something before having surgery. And some people like it, some people don't. They might end up going somewhere else and just getting the surgery right away. But that's not our approach. We want to always do the conservative first and give the patients the option. And there are some things that they come in that conservative treatments don't work at all. So we have to do it. So, if somebody has a big bump on their foot and, spurring and then, it's bothering them, that's not going to go away with any type of conservative treatment. You have to take it out. But, heel pain, things like that, as you mentioned, obviously 80% of my patients do well without surgery. And then 20%
what are you offering?
So as far as I'm doing like actually a minimal invasive plantar fascia release.
That was a big word. And my patient's looking at you like, what are you
So basically making a small cut as possible. So I've kind of figured this technique out for myself where I make a small incision, maybe about less than a half a centimeter even, just so that the blade can go in. And then under fluoroscopy, I check it and I actually use
another big word.
Yes, it's like a live X-ray machine at the surgery that we actually take a look at the bone. And
which is taking pictures in the operating room so we can see exactly what we're doing and where we are. And instead of it just being an X-ray that you go in one picture, it's live, almost like everything is moving. I just wanted to clarify that.
Exactly. So then I just use like a long burr, which I take out the spur and release the plantar fascia from the same incision. I put one stitch in there and they can walk the same day.
So I'm going to still break that down a bit. So what I love about that, and I do some of that stuff too, is that instead of so there's a variety of techniques for heel pain. I, like Dr. Langrudi and Dr. Eshraghi, I promote, of course, conservative care first, from physical therapy, strappings or tapings that we do, inserts, custom inserts where we take an impression of your feet and we have it constructed for you. I love Shockwave. I don't offer it in the setting I'm in now, but it will be. And also PRP, platelet-rich plasma, where you can take out blood, spin it, get the good cells, as Dr. Langrudi said, and re-inject it. Those are all great in office. I'm not taking you to the hospital types of radio frequency, which is another one you can do in office or at the hospital. I like Tenex, which is minimally invasive, as we were talking about, so that patients don't need a big scar on their foot and they can get back to function. And like Dr. Langrudi was saying, cutting the ligament that's inflamed, that's not responding to conservative care to release that tightness, which many people have, and hopefully get you back to function as quickly as possible. So I interjected, but I agree with you, Dr. Langrudi, on that. Tell us about bunions, because bunions are big. Everybody's trying to be cute. As I tease my friends, I say, you're making me money by wearing those cute Manolos, Jimmy Choos, Nine West. I don't care if Aldo's. Thank you.
Yeah, bunions.
Tell me about that.
Yeah, bunions we do quite a bit as well. Depending again on the type of the bunions, if the bump is really big and how much it's moved over in the foot, kind of dictates our procedures. I am offering the minimal invasive again on the bunions as well, where we shift the
What does
head.
that mean? Because I know a lot of people are like, minimal invasive. Ooh.
Yeah. So same thing. Again, we make a super small incision where we make then we go through that incision.
I think we lost Dr. Langrudi for a second, and it may be because he's West Coast. Angie, if you can hear, there you go, you're back.
Sorry, I lost you guys for a sec.
Yep. It's because you're West Coast, that's why.
Yes, exactly. It takes a while for it to go to the West Coast.
No problem. Continue.
So then, basically with this procedure, they're off of their foot. I usually have them off for about a week so that they don't put any pressure on it. And after a week, I actually have them walk with it. And they don't have any screw. They'll have a pin inside the bone, and I usually take the pin out in about 3 to 4 weeks afterwards. So that's the fastest one that we can do to get people back into their shoes. And this procedure actually is probably one of the best procedures out there because the range of motion on your big toe, it's amazing how much range of motion you get on that big toe after this procedure compared to the other type of bunionectomies. So, and then there's obviously certain type of bunionectomies where you have a lot of arthritis in the joints that you have to do joint replacement or make the joint shorter a little bit.
That, guys, that we do joint replacements in the toe. People think that's for the hip and the knee. No,
exactly.
Great toe as well.
Yeah. So those types, then we offer other treatments for those as well.
Awesome. So Dr. Eshraghi. So, and first of all, I'm going to tease because I'm saying Dr. Eshraghi, but these are my friends. I know her as Nazi and Andrew as Reza. Okay.
Yes.
Class of 2000. Ooh, I won't say what it is, but anyway.
Yeah.
So Nazi, if I'm coming in your office, you're talking about having a cash-based practice. Now, some people are saying, maybe I can't afford that. Explain. If you have insurance, like you mentioned, you're in a town with Blue Cross Blue Shield. Explain how that works for someone who has insurance. And then I want you to tell us concisely a little bit about laser that you offer in your office. Go ahead.
So cash-based, I haven't completely gone, but I am actually going to integrate a new software in my office. I currently have a medical software that I like, but I hate the fact that they bring all this third-party software and attach it to the main software. So I have been looking for something that it has everything, and with AI and everything, everything is moving very rapidly. So at the end of their visit, they get a claim, they get a chart note. I'll offer, care credit. They pay for their visit at the time of service. They can go claim with their own insurance. If the insurance pays us directly and they have a credit, we'll pay their care credit with the credit they have. And if they get paid directly by their insurance, then they get paid directly by their insurance. And the thing is that it's not only, there's a lot of doctors around here that are not accepting Medicare anymore. There is a lot of doctors that don't accept Blue Cross Blue Shield here. And there is a lot of little insurances that are popping out right?
So let
Less
me
than
interject and ask you a question, especially in the climate that we're in, whether you're a Democrat, Republican, we will not
Mhm.
touch that because that is not this kind of show. For people who may be going through financial hardships, how does one, if your practice, I'm assuming, is only accepting, again, there's certain, your clientele is going to be working class people who have great insurances, commercial plans, or patients that can clearly just afford it and don't even care about that. And that's the clientele I'm assuming around your area in South Carolina, correct?
They're used to paying cash.
Okay. Because I know some people who are listening are like, what in the hell? Because they're like, if it's not my insurance, then, short of having what is it?
The thing is that because
FAFSA
there's
and all those
not, there
different
is
types of
not,
things.
that's the good thing about, well, there's not that many podiatrists where I am. So there is a high demand
Mhm.
for it. So
Right
luckily,
place, right time.
yeah, I
Mhm.
have the option
Mhm.
to just wash my hands off of allowing a third party to dictate how I practice and what I want to do and when I want to do it and how I want to do it. And I have reached a part of my career that I know enough to be able to, show my patients when they come in and they pay for their service, pay for what they get, they leave happy and they come back. No problem.
So let me ask you a question, Dr. Langrudi.
Yeah.
So West Coast now, we're shifting from east to west.
Yes.
So do you accept insurance in your office? How does it
Yeah.
work when patients are seeing you?
Yeah, I mean, we take almost every single insurance in the office. So also we do give patients cash options as well if they're, cash pay. But I've noticed that throughout the years, in the past 10 years, most people out here in the West Coast do have some sort of an insurance.
Mhm.
It might not be a private one, but it could be a Medi-Cal program, but they do have. And then what we do is, no matter what the patients have, what type of insurance, if it's bad, good, no matter what, we offer everybody the same type of treatment, and they hear the
Which
whole
is
thing.
important. And I want you to repeat that again.
Yeah, so we offer every patient with any type of insurance all the treatments that are available out there, and then they have the choice of choosing what they want. I don't go by what the insurance dictates. I tell them everything they need, and they can decide. And then we do tell them, hey, these type of things are not covered, and certain things are not covered by any insurance.
Mhm.
So
Right.
then,
It's a
so
lot.
Exactly.
yeah,
It's
Exactly.
so
going that way more.
yeah,
Where a lot
but
of
yeah.
podiatry care is not covered.
Yeah, but I think that, a lot of times, unfortunately, doctors or institutions kind of fall into that category where they're like, oh, let me not just mention this because it's not covered or it's not,
Mhm.
the insurance is not going to, but the patients have the right to know, I think, if they're coming to see you.
So I fully agree with you. My practice, so I work for a federally qualified health center. So my patients can be anything from charity care,
Yeah.
just coming over to the country, where only things in the office, basic care is usually covered. Now, if you're using orthotics and bracing, that's a separate company, that's not covered. If they need physical therapy, they have to go to a physical therapy center. That would not be covered. And so it's basic stuff. We also have patients who have, as you mentioned, Medicaid-based insurances, and then we let them know what's out there and what is covered and what's not. And I get a few commercial patients that have followed me. Going back into private practice now, it's going to be more of a model where I'll have a lot more commercial patients, some Medicare, and then patients who will do cash pay. And I agree, I'm going to offer you everything and tell you what you can do and what you might have to pay for. And I think that decision should be left to the patient. A lot of times I think patients feel like the doctors are nickel and diming them, and it's not us. I will say that emphatically. It is not us. Your insurance is nickel and diming you. And we tell you, I know, Nazi, I know you want to jump in. Give me 1 second. But we tell you, hey, this is what's covered, this is not. And so you have to make certain decisions. Care Credit, which you mentioned, a lot of times dentists, as you mentioned, use that. I remember I did that for my dentist. And they'll say, dentists are quick. This is not covered. And you're like, what the? And you apply for it and you pay for it over a period of time.
Mm-hmm.
Some people don't like that model and they're saying that podiatrists shouldn't, but I think that more and more some of the specialty physicians are going towards some of that as well, with a mixed model as well. So things to know about. And I just wanted to give a quick shout out, Nazi, before you say what you're going to say, to Sandra Boyd. Thank you again. She said, God bless you and amen. So go, Nazi. What are you going to say?
I have all my prices listed on my webpage.
Amazing. So they know exactly what they're getting into.
They know exactly what they're, because most of the commercial insurances here are very high deductible, and patients have to pay at the time of the service. And a lot of people have not met their deductible when they come and see the podiatrist.
And guys, the deductible. So don't think that, again, we're nickel and diming you. Your insurance will say you have to have met $500, $1,000, $2,500 of service before they'll start to pay. That means that money's coming from you. So a lot of times people don't know that they have a deductible. They don't understand how high their deductible is.
Right.
And then they're looking at us when the bill comes from any doctor, and they're like, what the heck is this? And I'm like, that has nothing to do with us. Until you've met that, you owe us this amount before your insurance will say, thank you, Dr. Shragi, for services. Thank you, Dr. Lingrudi, for services.
So the thing is that here in South Carolina, most of the practices, there is hardly any private practice. They're all like clinic settings where they see everybody and they eat the cost.
Mm-hmm.
So
you're offering an a la carte concierge kind of practice because of being a solo practitioner in that type of area.
Yes. Mm-hmm. So when they go to the clinic, even if the insurance doesn't pay for it, the clinic eats it. So they're used to not paying for anything. So I have no choice but to educate and let them know, well, no, I am not part of a big corporation where I can eat all the cost.
Mm-hmm.
When I see you, you need to pay me.
Absolutely.
Yeah.
So let me ask a question. And guys, if you have any questions, whether it's insurance, surgical techniques, things that they offer in their office, please ask, because these are well-versed, boarded doctors that can give you tips. And if you live in another state, get good tips from us to bring back to your provider to see if they're giving you the right information and the right care. So let me ask you a question, Nazi. Everybody wants to be cute, and laser therapy for nail fungus is big. Some people don't want to use a topical. As we know, nails usually take 6 to 9 months to grow out. People get lazy. Life, as they say, life be lifing. And so it doesn't always happen that way. And then people are health conscious. A lot of people sometimes don't want to take oral medication, which we have to do blood work on to make sure that your body can tolerate it. So lasers, and one of the newer things, I used to offer it in New York City, and hopefully we'll offer it in New Jersey now, going back with private practice. Tell us a little bit about that, because summer, it may be hot and sunny in Southern California, but
oh my God. Fungal
right?
nail here
is big, and people are getting we're getting warm days, and the Northeast goes buck wild when we get a 70-degree weather. Everybody's out sick in Central Park or hanging out and enjoying themselves. And one of the things my former pastor, God rest Dr. Calvin Obutz III from Abyssinian Baptist Church in Harlem, the joke we had, and he came up with, when people would be around me and hide their foot, and he would look at me, and I said, I guess it's because I'm a foot doctor. He would say, sandals is a privilege, not a right. And I'll always remember that fondly. So for it to be your right, tell us a little bit about laser.
So I really educate my patients so they know that one-time treatment of a laser treatment on nails that are super thick is not a cure where they walk out and all of a sudden they have these beautiful, healthy toenails.
Only Jesus lays hands.
So most of it is education of the patients. When they realize that, the damaged nail has to fully grown out before they're in the safe zone. And if the nail is damaged and it continues to grow damage, the chances of you picking up fungus along the way constantly is high.
Mm-hmm.
Then I tell them that, this is how much it is, $500 for both feet. You come in, and you have to come in every couple of months, because it just basically kills the fungus at the time of the treatment or reduces the count of the spores. having had said that, you have to change all your habits, change the environment so the fungus doesn't continue to grow back in the damaged nail. And you have to come back frequently as the nail grows out, and you have to get it debrided, that's where the medical pedicure comes in. You'll be able to shape their toenails. And I also, at the same time, they have to do the topical treatment to keep the spore count down while it's
So when
growing
we say
out.
spore count, we're talking about fungus has something that looks like a circle and has little infectious spores, that's what they're called. And so that's what I always trying to make sure we're using basic English, because sometimes doctor talk and patients are like, wah, 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 like Charlie Brown. So I appreciate you saying that. And I have a question for you, Reza, because of what Nazi said. You said that you had products. Unfortunately, I did not get them.
Oh, I'm gonna resend it to, actually, I'm gonna send it to both of you guys, because I had you guys on the list. I don't know what happened.
I know. Again, West Coast. But
yes, exactly. It takes a long time to get there.
That you're offering, that you and Nassim offer. Tell us a little bit about it.
So fungus is the big thing. So throughout the years, in the practice, what we always were missing is something that the patients need to actually soak their foot in to get the interdigital stuff. But there's, as you know, all the medications are, I'm sorry?
Interdigital, what's that?
Yeah, between the toes. So everything between the toes, all the cracks, it's hard to get, the medications in there, because everything is oil-based and it doesn't really absorb as well with the skin. So, and then you can't put the oil in the water, because then it's ineffective.
It's on top of the water. Remember that, guys? Chemistry 101.
Exactly. So what we did, actually, it took us 6 years. We actually figured out a formula how to make antifungal water soluble. So which means that if you pour it in the water, it actually dissolves. Most of the antifungals, when you put it the powder, it doesn't work and it doesn't get absorbed. It separates if you look at it in the water. But this medication that we made, it actually mixes, and you can actually soak your foot in it, and it gets in between the toes. And the good thing about it is that our skin is hydrophilic, which means it absorbs water. So is the nail, and so
I'm proud
is
of
the
you breaking down those big words.
Yes, so is the nail bed. But but the oil doesn't do that. All the oil, and the patients always complain, hey, we put the sock on and it gets absorbed by the sock. So we made this, and now the patients can soak their foot. And another thing that the patients always tell us, what is it? Oh, I went to the pedicure and got it. So, we got the fungus from the manicure pedicure
That's
place.
right. That little purple light that you guys love to talk about, that
exactly.
is squat, okay? And you really need what's called an autoclave. It's a device that looks like an oven that gives off high temperature that your normal oven cannot do to kill any bacteria, any type of infectious process like they do in the hospital. Correct. Otherwise, you're picking up the last person's infection, short of using your own instrumentation, which I always recommend. And I tell people at least soak it in alcohol for about 15, 20 minutes and let it dry, and make sure it's yours. Nobody
and
else.
Those nail polish, especially the nail polish, dehydrates the nail, damages it, and then you pick up the fungus really easily.
So we actually made something for the salons. It's a manicure pedicure set. So every time the patient goes to the manicure,
I want mine.
Yes. So you can take the bottle, pour it in the water, soak there, and then it has a spray. After you're done, you can spray it to make sure that you don't get anything.
I love it.
Kind of to prevent, cure, and prevent. That's what it does.
I love it.
I love it.
Guess what? I am the queen. I think women more so, and Dr. Shraki, you can probably agree with me. There's one thing for a man to be a podiatrist, but a woman says it, and automatically, what do? They look down at your feet. They're not looking at your feet, but they're definitely looking at mine. So I stay with the pedicure because I'm like, I got to be cute. And yes, Keisha, who's watching, thank you. No gel nails. I actually gave a presentation. I've done it twice so far about gel nails. Everybody asked me that. And I'm like, what happens is that it's not hydrophobic, meaning it doesn't avoid water. So there's a little space, whether you see it or not, that is between the actual gel and between your nails. And basically, water goes in there, and bacteria and fungus, particularly fungus, it's like throwing in a party. It's having a fiesta because water is allowing it to grow and multiply. So when people think that gel nails are great on their feet, really it's not. And I don't think any podiatrist worth their salt would tell you do a ped. Now, if you're trying to do real quick for a quick wedding, I get it, but why not do a regular pedicure if you can? You know, if you're afraid of chipping, I get it. But if you're doing this on a constant
Buff
basis,
your
you're going to be
nail.
seeing Dr. Eshraghi, Dr. Langrudi, and I. Thank you very much. We appreciate your services and your patronage. Come on down, because that's what's going to be happening. So we appreciate that. So let me ask some more questions. Yes, Keisha, next time. As we are getting into the last 10 minutes of our show. So I want to ask some fun questions. So Dr. Eshraghi, we know you're a whole podiatrist that left the West Coast and came to the East Coast. Tell us personally, tell us about the things that, you know, people always think that doctors are just, and we are not. We are so multifaceted. We have families. We do things that, you know, give us joy and things to the community. So one of the questions I like to ask is, what do you do for yourself? And what is your community footprint? What do you do where the community, besides your everyday practice, where people are like, that's Dr. Eshraghi, I saw her. Go ahead.
Well, I'm pretty new to the community because we came here during the pandemic, and the community is pretty small, but it's growing at a very rapid stage. So just me being here in the community, bringing podiatry is just huge. And even though I'm a cash base, there is a lot of little insurances here that don't cover anything. And I give a lot of discounts. It's like usually, you know, if a patient comes in, most of my patients are it's a small practice. It's very family oriented. It's a small.
But what do you, I love your practice, but what do you do for you? What, besides the doctor stuff, what does Dr. Eshraghi do?
I am addicted to gardening. I garden at least 1 hour a day, and sometimes 7 to 8 hours on the weekends. My husband goes crazy. I am out there because I just love to garden. I have a lot of fruit trees. I have a lot of vegetable garden. I am always out there. My neighbors probably think I'm crazy. Digging in dirt and digging hole, and very much so. It's like going hiking and exercising and getting my sunshine, because I'm usually indoor for a good 10 hours a day. So, and I live very close to my office. It's only like 5 minutes away. And my husband is my office manager. So him and I come home during lunchtime, have lunch together. Sometimes I take a nap, and then I go back to my office.
Life. Andrew and I are looking at you like, what? So Andrew, let me ask you a question, because I know you practice with your wife as well, who could not be on the show today. Tell us a little bit, something that you do for yourself personally and any community footprint that you leave behind.
Yeah, so practices, we actually practice separately in different offices, not in the same office.
I think that's smart.
Yes, exactly. We decided to stay married. So, but as far as, you know, personal life, you know, we have 2 kids, 2 beautiful kids that take up most of our time right now. So they're in high school, both of them. So spend a lot of time with them. And then whatever time is left, we party in the West Coast.
All right now. Okay. You know, I have not been to California. I've been to Beijing and back. I've never done Cali. So
you have to come and visit us.
And then be like, okay, I got to see you guys, Devin, the whole crew. But
yes,
that's in my CPM class of 2001. And I'm like, we hide these gray hairs, keep the, you know, and stay cute. I'm doing the fabulous auntie life. So that's what I'm doing. But, you know, as we close, I want you guys in 30 seconds or less to tell me where we can say your names over again, the name of your practice, where we can find you on social media. And I'm going to type in your name right now. I know we have Complete Feet Care. And Dr. Eshraghi, give us a 30-second plug.
So Nazila Eshraghi. Name of my practice is Complete Feet Care. That is the name I have had since the beginning. and I have brought it with me from West Coast to East Coast. And you can find me as CompleteFeedCare.com on the web and Complete Feed Care on Facebook.
Fantastic. Got you. I'm putting that in. Dr. Andrew Langrudi, where can we find you?
Yes, you can find me on footsurgeon.com is our office website, and our products is drantifungus.com, and on Instagram, Dr. Antifungus.
Wait, that was fast. Dr.
Sorry.
Antifungus?
Yes.
DR or DOCTOR?
Oh, DR, right? DR.
Dr. Antifungus.com.
And same thing on Instagram.
All right, I love it.
Oh, Reza, I really like the solution. It's good for geriatrics where they cannot reach their feet.
Absolutely. I mean, there, we did make it also actually in the spray form, so people can also spray it.
Oh no, my patients need soaking.
Yeah,
so let me say this as we conclude. You guys are making me laugh. If you guys watch the show, and I think Dr. Langrudi has a fantastic product, the first email I get, and you can find me at Talks with Dr. D on Facebook, LinkedIn, and Instagram. And my website is www.talkswithdrd. The first person who emails me, which is info, and I'm going to put this in here at talkswithdrd.com, we will give a set to you, because I think that's great, because people are like, what is a set? I'm getting, get asking me questions. And we'd love to do that. You can find me monthly on blackdoctor.org, where we have this wonderful platform where it is a platform for all podiatrists and medical providers, regardless of creed, color, race, ethnicity, to educate folks and entertain folks. A lot of these folks are colleagues, and some of them are friends. And you can see the banter that goes back and forth. We're not going to bore you on a Wednesday night. That's not what Dr. D does. Too Many Talks with Dr. D is an umbrella organization for all things that are fabulously me, such as Sisters on the Vineyard, which is a solstice for health and wellness, financial literacy, and empowerment, occurring yearly on Martha's Vineyard during August. This year is going to be fabulous. If you log on to sistersonthevineyard.com, again, sistersonthevineyard.com, you'll find out all about our event, which is August 12th, Oak Bluff Stalling. Also, Talks with Dr. D Breast Cancer, which is one of our philanthropic arms for all things breast cancer. As you guys probably know, I'm a 5-year survivor. I've had the pleasure of speaking on women's organizations, the Divine Nine, and even the United Nations. And I continue to educate folks, couples, individuals on breast cancer and survivorship. And then lastly, stepping forward, Dr. D, we're in season what? This is season 2. And we're very excited to have these guests, Dr. Andrew Langrudi, Dr. Nazila Eshraghi, on the show. We hope you'll follow up with us in May. We're always the first Wednesday of the month at 7 o'clock. We hope to be talking about pain in May, because people got pain. Lord, do we have pain? And various ways to treat pain. And we thank you always for tagging us. Again, subscribe to my YouTube channel. Like us. We appreciate that. On social media. Follow these doctors if you live in the area and get great care. I would go to them myself because I trust them. It's been our pleasure to have you on the show as always. And my favorite thing to tell you guys is walk strong. Thank you, everybody.
Thank you.
Thank you.